Trachoma is the most common infectious cause of blindness worldwide. It is a chronic keratoconjunctivitis caused by recurrent episodes of infection with Chlamydia trachomatis. The WHO estimates that over 2 million people are visually impaired from trachoma, with half of these being irreversibly blind. It has been identified as a priority by the WHO, both within the Neglected Tropical Diseases Programme and Vision 2020. In this talk, I will be looking at the history of trachoma, the prevalence and geographical distribution, the biology, the clinical features, and the burden of trachoma. The second trachoma talk will cover risk factors, transmission, pathogenesis, and control strategies. The earliest references to trachoma come from China in the 27th century BC. Features of trachoma were also described in the Ebers papyrus from the 15th century BC. At the beginning of the 19th century, trachoma became a major public health problem in Europe, when the disease is believed to have been brought back by troops returning from the Napoleonic Wars in Egypt. Many of the major ophthalmic hospitals founded at that time were established to treat trachoma, including Moorfields Eye Hospital and the Massachusetts Eye and Ear Infirmary. Immigrants to the United States at the end of the 19th century were routinely screened for trachoma and sent home if they had signs of the disease. Trachoma has now generally disappeared from developed countries, probably as a result of improvements in living and hygiene standards. However, trachoma is still a major cause of blindness in many less developed countries, especially in poor rural areas. Blinding trachoma is endemic in over 50 countries, with the highest burden of disease in Africa. It is also found in the Middle East, Asia, Latin America, and the Western Pacific. Active trachoma affects an estimated 21 million people at any one point in time, with around 7 million having trichiasis and a further 2.2 million blind or severely visually impaired. An intense global trachoma mapping effort is currently underway. The 2002 WHO survey estimated that there were 1.3 million people blind from trachoma, and it is likely that there are another 1.8 million suffering from low vision. These numbers may well have been underestimates, however, as many of the other 1.9 million people who are categorized as being blind from corneal opacities in trachoma endemic countries may well have been blind from trachoma. Some caution does need to be applied in the interpretation of global estimates of trachoma, as they tend to rely on limited data with many extrapolations and assumptions being used. However, there does appear to be a clear downward trend in the number of people with active infection. Improved living standards probably account for at least part of this trend, and also the implementation of trachoma control programs.
If you enjoyed this lecture so far, please subscribe to http://iop.vision. I hope you enjoyed this series as much as we have putting it together. Thank you.